Yes, we are ready to start.
Okay. So, good afternoon, everybody, and wishing all of you a very happy World Optometry Day. So, as we all know, today we are celebrating World Optometry Day, and on behalf of it, Optometry Confederation of India has initiated this journal club session in coordination with OOLS, that is Online Optom Learning Series. So once again, I wish all of you a happy World Optometry Day. And so today we have Mr. Kayur and Mr. Fakhruddin, who will be moderating today's session. I would like to introduce Mr. Fakhruddin, who is an Indian optometrist currently working as senior lecturer at Seji University in Malaysia for over a decade. He primarily teaches the subject of contact lens, and he's also actively involved in research within the area of anterior eye and contact lens. Fakhruddin, he has conceptualized an online learning platform called Online Optom Learning Series OOLS, and he has completed his post graduation in optometry from Lotus College of Optometry and also his undergraduation. So we welcome Mr. Fakhruddin.
Thanks, Bhavya.
Next, we have Mr. Kayur. Mr. Kayur is currently a graduate research assistant from University of Alabama at Birmingham. He has completed his Doctor of Optometry from University of Alabama at Birmingham, and also he has completed his Bachelor of Science Optometry from Lotus College of Optometry. Mr. Kayur has actively participated in many scientific presentations, and also he has co-authored and also authored many peer-reviewed publications and journals as well. We welcome you, Mr. Kayur.
Thanks.
So now I would like to give the session to Mr. Fakhruddin. So over to you.
Thank you, Bhavya, and thank you to the Optometry Confederation of India to partner with us and do this series of journal clubs. I think when we started discussing about what can we do for students in India, and is there something lacking in terms of research paper reading and presenting, I think journal club stood out, and the thoughts aligned that we should do something together. So thank you so much from the bottom of our hearts to start this on the very important day, which is the World Optometry Day, and having Dr. Srikant with us leading this first session is a great importance. So we our plan is to kind of run this session to give you a brief overview of how a journal club, how to read a paper, how to present a paper, and then eventually we're going to share more details about how can you be a part of this journal club, which will be running in a periodic fashion. So thank you everybody for attending today's session, and I'll let KU to start off us with introducing about a little bit of background, and then we'll welcome Dr. Srikant to lead us the way.
Thank you, Fakhruddin. Um, so, and thanks, Bhavya, for the kind introduction. So, to start off, I wanted to speak a little bit about the importance of a journal club and to actually focus on why journal club is important for kind of everyone, not just students and people in academia, but also someone who is practicing. And one of the best examples I get is for evidence-based practice. When I was in school, which was less than a decade ago in Mumbai, I never heard of Demodex blepharitis. This was not something that was taught to me. Now it is a big area of management. And even when I finished school, the Demodex mites, our stay of treatment was baby shampoo. I still remember the ophthalmologist I was working with, his go-to was, yeah, use water and baby shampoo, make sure you clean your lids. And then since then, we have moved forward to include many other treatments. One was tea tree oil, which was a couple of years ago, and it's moved fast enough that now intense pulse light is being used in most places as a quick form of treatment. And I believe that is also at this point kind of not outdated, still being used, but we've moved ahead to eye drops that are available. And if you aren't involved in actively reading new research or understanding what's happening out there, your patients and you yourself might be missing out on key opportunities on how well to treat your patients. And the second part is it helps improve skills for research and academia, and it also helps develop analysis skills. If you read what other people are doing, you will understand yourself and to critically think about how research should be conducted or what you should be looking for when reading a research paper. Communication is important, not only with when presenting your papers, posters, etc. Um, at school, but also with your patients. And everyone today is Google Doctor. Like they ask Google Doctor, and they would show up with that, and you need to know what's out there to actually refute incorrect advice, or you have to be aware so that you can make your patients aware. So yeah, importance to better communication skill is a key aspect of Journal Club, and hopefully through this, you can develop those skills by watching experts talk about topics that you're going to come across every day. And last but not the least is professional development. Gone are the days when you can say, "Oh, I studied optometry 20 years ago and now I'm an expert." People want to or need to know how you've been keeping up with things and how you have been connecting and networking with your peers, how you're aware of the field. And it's a fact about lifelong learning. And Journal Club, again, is an easy way, easy segue into those skills. And so, with all of that, if I haven't convinced you about the importance of Journal Club, I believe the best person would be Dr. Shrikant Bhardwaj. A brief introduction about him is that he completed undergrad from Elite School of Optometry, Chennai, went on to do his PhD in vision science at University of California, Berkeley School of Optometry. I believe they've renamed themselves to Herbert Wertheim School of Optometry now. USA, he did his postdoc training at Indiana University. So you can see a lot of research training there. Then Dr. Bhardwaj returned to the LV Prasad Eye Institute in Hyderabad to establish the visual optics research laboratory. And his goal was to understand how the eye and optics influence spatial and depth vision using experimental, behavioral, and computational techniques. He has countless international peer-reviewed publications, and his work is supported by the government of India and the optical industry through various grants. If
Corporate journal.
Since Dr. Bhardwaj has more than 24 hours in a day, he has also been serving on editorial boards for optometry and vision science, vision research, nature scientific reports, and PLOS1. I don't know how he manages to do all of those things, but hopefully one day we can all learn. And he also serves as the Network Associate Director for the Brian Holden Institute of Optometry and Vision Science at LVPI, and is actively involved in teaching students of optometry there. In 2023, he was awarded the Fulbright Nehru Academic and Professional Excellence Fellowship to pursue research on the optics of keratoconic eyes at the University of Houston College of Optometry. And as a personal anecdote, I would say he was also the reviewer for my capstone project that I did while I was at Lotus, and was my first interviewer because I applied to get a job at LVPI, and he was the first interviewer for that. Unfortunately, the stars didn't align, and I followed in his footsteps to get a PhD in the US instead. But yeah, so thank you so much for agreeing to do this session for us, and I'll let you take it over from here.
Thank you so much, Keyur. That's a very generous introduction. And if I have 24 hours more than 24 hours in a day, you should actually ask my wife and child. They will tell you a whole different story of how the prioritization happens. At any rate, thank you. Thank you very much. Thanks, Fakhruddin. Thanks, members of the OCI, for inviting me to give this talk. And happy World Optometry Day to all the attendees in this. And I'm actually amazed. It's Sunday afternoon, 3 o'clock, and I thought we are not going to have too many audience for this, but 50 of us in this room listening to something that's largely academic truly makes me feel that optometry has a very strong future moving forward. So well done, Fakhruddin and OCI, for putting this together. Let me share my slides, and in a minute we can get started. All right, are my slides visible, and am I audible?
Yes, sir.
All right, great. Okay, so at the topic that I was asked to present was how do you read a journal club? How do you read and present a journal club article? And when this was allotted to me to speak, I thought I should use this opportunity to probably do three things in this conversation. Not only how to read and present it, but put a context to what we are doing this for. And in many ways, Keyur made my job easier by presenting the context. So I'm going to repeat a lot of what he has said in the beginning and then move on to my actual presentation of reading and presenting a journal club. Right? So, so three core questions that I will address in my talk. One is, what is a journal article? Many of you would probably already know this, but those of you who are new to this trade, it's probably important to know what really are we talking about. How do you differentiate this from other forms of scientific, non-scientific communication? Second is, why should I be reading this? And this is where I think I'll overlap with what Keyur was indicating. And finally, we'll talk about the bulk of my talk is going to be how do I read and present this article that you have chosen, right? So to begin with, we need to differentiate a scientific article from a magazine, right? The top row are all pretty regular scientific, mainstream scientific articles in our optometry, ophthalmology, and vision science world of things. And at the bottom are either magazines that may talk about science updates, and in many cases it may not talk about science updates at all. So fundamentally, when you start thinking about a scientific article, a scientific journal, you want to differentiate between what a magazine is versus what a scientific article is, right? So what are the differences? The main difference is it's the scientific article is meant for a very focused scientific audience, like the ones that are sitting and listening to my talk here. Every optometrist out there, every practitioner, student, vision scientist, like what Keyur mentioned, ought to be following the scientific articles for the reasons that I will mention in the next few minutes. A magazine is meant for smart individuals, but who may be new to that area of that field. Say, for instance, if I am reading an article in India today on something about, say, India-China relationships, it needs to be, I believe I am smart enough to understand what is going on, but I may not know the nuances of what is happening, the nitty-gritties of what is going on. So the way a magazine article is written will be very different from the way a scientific article is going to be written. The second is, for the reasons that I'll mention, the scientific articles are very boring to read, right? It's very cut and dry kind of science that is presented, whereas the ones on the bottom have the potential to add some general knowledge to you, right? The third difference is it's written with a lot of technical jargon, because the assumption is that people who are in that field, who understand the way science is conducted in that field, are the ones who are going to be reading this. So a lot of assumptions are made about the terminologies that are used, the fundamental understanding of the topic that is being done. So it's written in a way that it is using a lot of technical jargon. Whereas the magazines are written for a more general audience and therefore uses more general English or vernacular language. What are the commonalities between the two? Both forms of, both the scientific article and the magazine article, both of will contain figures and tables, right? Our figures are going to talk about the research that was done, the outcomes that was obtained from the from that research. The figures and tables that you will see in a magazine are research done by journalists, and it's going to present the same evidence in the form of slightly different kinds of figures and tables. So you are going to encounter figures and tables in both. Both of them have a story to tell you. If they are engaging you for the next 15 minutes or 20 minutes, they better be telling you a story that is worthwhile of the time that you are spending. Second, both are expected to be based on evidence, right? Scientific articles, especially so, are meant to be based on the evidence, and that's what, as a reader, you are going to evaluate that scientific article for how much of it is evidence-based and how much of it is the opinion piece. Having said that, both of them have biases in it. And one of the things as a journal article presenter, we try and identify, okay, how much of what the audience, how much of what the authors are saying is actually based on the scientific evidence, and how much are they extrapolating to their own benefit based on the biases that they may end up having. Now, whether you are in a scientific field of work, optometry, ophthalmology for that matter, or if you are a general audience, you need to be reading both of these to keep yourselves updated. And this is where I think Keyur was pointing out as to why you should be doing that. But before I do that, there are a couple of things that I wanted to actually point out. And this is once again for the benefit of people who may be new to this area, is to, the goal is to try and understand what is a scientific article and what's the organogram of a scientific article, right? So I'm picking Optometry and Vision Science, the publication by the American Academy of Optometry as a flagship journal article here, and I'm presenting their organogram of how it functions, of how it functions. So this is more or less true for every journal that is out there publishing articles. So to begin with, the very top of the organogram is the publisher. These are the guys who say, okay, we need to put together a journal that is going to give audience a certain update on a weekly basis, on a monthly basis, or a quarterly basis of what are the updates in that field. Now, the publisher for Optometry and Vision Science is somebody called Wolters Kluwer. Like that, there are many big publishers. Nature Publishing Group is one, Elsevier is another, Wolters Kluwer. Like that, there are probably 10 or 15 major publication houses that ends up publishing journals that are meant for optometry and vision science audience. Now, the publisher then essentially conducts the activities of the journal through the editor-in-chief. So the editor-in-chief is the primary person responsible for that journal. The journal is represented through the editor-in-chief. For Optometry and Vision Science, Professor David Elliott from Bradford is the editor-in-chief. This is usually a rolling position. Once every 5 years, the EIC's role keeps changing. People apply for this role and then they get onto it depending upon their credibility. The editor-in-chief, in turn, actually works with two groups of people, an editorial board and an editorial staff. The editorial staff, which we are not going to focus too much on today, are the ones who will ensure that administratively your article is getting published, it's going through the process of peer review and all of that. Patty, as is indicated, she is the primary editorial staff for OVS. The editorial board typically consists of a bunch of people. For OVS, the editorial board currently is about 28 people. I'm happy to be one of them. And it is our responsibility, or the editorial board's responsibility, to ensure that articles are sent out for peer review. Articles that are submitted are actually sent out for peer review. You find reviewers for these articles and essentially do the due diligence to ensure that the article is worthy of getting published and it's communicating some new scientific knowledge to the field. The editorial board, in turns, identifies anonymous reviewers who will review the article that is submitted by the author. So, in general, this is the organogram of a journal. Now, when it comes to an article that is to be published in that journal, many of you are in that trade of things, or you will be in the trade of things in the future. It's important for you to know what the process of this of publication is. So, as a first step in that process, once you have finished your science, your project, you have gotten the desired results that you want, you have written up that paper, gotten some reviews for it internally, and you're now ready to send it out for peer review, right? That's when you will submit the manuscript into the journal's portal. Each journal has their own portal, fairly easy to use. And once it is submitted, the first person to look at it will be the editor-in-chief. He will determine, okay, what's the quality of the manuscript based on the abstract and the cover letter that you have written. Now, at the editor-in-chief's level, there are two decisions that gets taken, okay? First decision is, yes, this article is worthy of going to the next layer of peer review. So he assigns an editorial board member. Or he says, no, it's not good enough. It doesn't fit my journal, or I don't see value in the science that is being done. You are presenting stale information, or you're presenting non-scientific information. So I'm going to triage it and reject the article from publication. In which case, the article essentially goes out of the journal. Information is sent to the authors, and they have to now go and look at some other journal for publishing this work. If it goes through the editor-in-chief and it gets assigned to an editorial board member, our responsibility as editorial board is to assign peer reviewers, or at our level, we can also triage the article saying, well, the EIC may have been happy with it, but I don't see any value in this. I can also triage it, and then I can get the article rejected from this, right? Assuming I assign peer reviewers for this, the manuscript gets reviewed by typically 2 or 3 reviewers, anonymous reviewers. You do not know who these individuals are, where they are located in this world. And they simply look at your article and review the scientific contents of it, and then they provide their feedback. Based on the feedback, one of 3 decisions actually gets taken. The most common decision will be, or actually let me not even say most common, 3 decisions gets taken. A reject decision, in which case, there's the same fate of that article happens. You get, the information is sent to the authors, and the article is out of the peer review process. Very, very, very rarely the article gets immediately accepted for publication, and your article now gets published in the journal. Most commonly, what will happen is a revision for the article is suggested. The revision being that, hey, this is okay, but you need to make A, B, C, D, E changes to that article. And based on that, you will essentially get another chance for publishing this in the journal. A revision is not equal to rejection of the article. That's the first major point I want to make. I am emphasizing on this because the first article that I sent out for peer review while I was in undergrad days, it actually came back for revision, and I interpreted it as, no, they are not interested in this. They have rejected my articles, and I never bothered to actually send it back for revision. So for those of you who are new to this process, a revision does not equal rejection. A revision means there is an opportunity for you to address the changes that the reviewers have suggested and get the article published. That process is an iterative process. The revised version gets sent back into the journal, goes through the same process of review, and usually a couple of different levels of revisions gets done before the article gets finally accepted for publication in the journal. This entire process, the reason I am putting through you all for this entire process is to emphasize one of two things. One, it's a very rigorous process. When we say it's a peer-reviewed publication, it means that it has gone through all of these stages. Multiple people have looked at it and they have said, yes, this does contribute valuable information. So a peer-reviewed journal article is a good one for you to actually pick up and do your journal club for. The second is to emphasize the fact that this is a time-taking process. It typically takes about 4 to 6 months long in order for you to get an article accepted for publication. Only about 10 to 15% of all the accepted article, of all the submitted articles actually accepted. This rate depends upon different journals. I am talking optometry and vision science rates. If you go to higher end journals like Nature or PNAS or Current Biology, their acceptance rate is about 1 to 2%. 98 to 99% of articles that is submitted to them are rejected. This is not necessarily meaning that the science work is bad, but it's just that they are looking for very broad areas of work that will address a large group of audience. Anything specialized, they will ask you to go ahead to these specialized journals. But point being that for an article to get accepted of all the submissions, only about 15% is actually getting accepted. Once you are done with the article, you transfer the copyright to the journal, essentially saying that whatever science, whatever figures that are published in this no longer belongs to me. It actually belongs to the journal. It belongs to the publisher. And you pay whatever open access fees or a subscription model for that article to actually get published. Now, there are two stages. The very last stage of this is once the article gets accepted, they will format it. The left one is a formatted version of the article. They will ask you certain queries to make sure that, okay, things are all right. This is a paper that we published in OVS a few years ago. And this was the formatted version, the author's proof, for us to look at it and say, hey, everything is fine and all of that. And finally, once you accept it, this will be the final version. The right-hand side is the final version of the paper for the external world to read. And once it is published, if you focus on the highlighted region of the slide, you will have a journal name, an year in which it is getting published, 2023 in this case, and an issue number, 100 in our case, and the page number 614 to 624 page. So about 10 pages long was this article, and it appeared in 2023 in Optometry and Vision Science. You can use this information to go and search for that article and find out, okay, what are the details of this. The date of issue is not that very critical, so I am going to ignore that. Notice the copyright. The copyright no longer belongs to me. The copyright actually belongs to the American Academy of Optometry. This is a debatable issue that I am going to park for now. But tradition as it is to transfer the copyright onto the publisher or to the publishing house and no longer belongs to the author. All right. So yeah, journal, publication year, all of that. Okay, so now that you know what the process of publishing an article is and how rigorous that process can be, sometimes intimidating to newer researchers, question is, why should I even be doing this? Why should I even be engaging in research? Why should I even be reading these articles? Sounds like a pain. Why should I do this? Now, you think about this. Research in general, it's an act of systematically studying a problem, right? And communicating that new knowledge and deriving new knowledge and communicating that new knowledge to the benefit of humankind and to the profession at large. So the very act of performing research involves communicating that to the larger audience, and journal articles is the primary mode of doing that. Yes, you can get into webinars like this and talk about it, or you can get into conferences and talk about this, but the extent of reach that a journal article has does not have is much larger than what you will get with these conference presentations, and it's there for posterity's sake. Once an article is published, it is archived in the scientific literature, and I'll show you some examples of this as we move along. So that forms the primary mode of communication, and the health of any profession is gauged in terms of how much of contribution to research and development has actually been done. In fact, at the time when the NCAHP Act was actually being put together, and some of us were working with the government to find out, okay, what does it mean to go through this? One of the comments that an IAS officer who was in charge of this made to us was, optometry is fantastic because you guys have not only organized yourself very well, but you have been constantly publishing work telling me that you are up to date with the profession. You're not following stale practices, you're following state-of-the-art practices. So as a profession, we have gotten benefited because there are several of us who have been contributing to research, several of us who have been updating ourselves with the research activities. So professional insecurities, in my mind, are successfully overcome once you engage in research. You no longer have to worry about somebody else and somebody else coming and taking over certain things that you do, or be worried about your neighbor taking over the job that you're doing. If you are scientifically inclined and if you are scientifically keeping yourself updated, your focus will be on how do I keep myself updated for the next layer of technology development or scientific development that has happened. What my neighbor does or not is not my concern at all. I am going to keep moving forward as the science is evolving. So I personally feel professional insecurities are overcome, and it certainly promotes what we call as evidence-based practice of optometry. And the day of the World Optometry Day, I do want to emphasize that knowledge in optometry gets updated once every 2 years. In fact, that's true for across the medical disciplines. Every 2 years, you have something new that is coming in that's going to come and change the shape of the way you are practicing. So if you do not keep yourself updated through reading journal articles and stuff, trust me, you're going to be redundant in about 10 years' time. No, you are going to have stale information compared to your peers, and sure enough, you're going to feel professionally insecure about your role compared to your neighbor's role. So for all of these reasons, like what Keyur was also pointing out, I think it's very critical that as a professional group, we are all contributing to new knowledge, and we are also assimilating that new knowledge to keep ourselves up to speed. After all, in God we trust, right? And all others must bring data. I cannot be talking through my ass, pardon my language. I cannot be talking through my ass, but I have to be talking only based on the evidence that I'm having, right? And that's truly the essence of what is evidence-based practice of medicine, evidence-based practice of optometry. Yes, sir. All right. Now, given that, what is the best possible scientific evidence, right? I did a back of the envelope calculation a few years ago, and a staggering number actually came to my mind. There are roughly 46 journals of optometry and vision science that is published annually, right? And these 46 journals have monthly issues. And in every monthly issue of the journal, there are about 8 to 9 articles that are published. You do the math and you quickly find out that there are close to about 8,300 articles, new knowledge that is getting published every year, right? And if I have to assimilate all of that knowledge, I need to be reading 32 research articles every day. Now, that is a daunting task, even for somebody who is full-time in research. And like what Keyur said, even if somebody has 48 hours in a day, it is impossible for them to be getting up to speed with things. So given this vast knowledge and given how busy we all are with our lives, how do I even managed to stay afloat with this new knowledge. And that's where I think we should thank people who put together this pyramid of scientific evidence, right? The lowermost on that pyramid is the expert opinion. This is not scientific evidence. This is what we are calling as eminence, based on somebody who has done this over and over and over again. They are forming certain opinions. Above that are case reports, cohort studies, and then we move all the way to systematic reviews and meta-analysis. So depending upon what level you want to keep yourself up to date, there is a pyramid of scientific literature that you can actually follow. And in a minute, I'll tell you what that really means. In this context, it's important to notice that scientific publication has now become a game for many people. There are predatory journals that are there in the field that will promise to get your work published within a very, very short period of time. It's a shame for me to say this, but the largest predatory publisher across the whole globe actually has an office about 5 kilometers away from me here in a suburb next to Banjara Hills. That publisher pretty much will publish articles in any field that you can think of, from optometry and vision science all the way to gynecology, to neuroscience, to physics. They have these journals in there. They are not good quality peer reviews. They are not going through the process of rigorous scientific appraisals. They are a paper mill that essentially is milking you for money. So as a knowledge consumer who wants to keep up to date, beware of these predatory journals. Also be beware of gray literature, which includes opinion pieces, non-peer reviewed articles, blogs, etc. And I'm specifically addressing this to the students who may be attending this talk, because every time I ask my students to go and look for something, they put in a keyword in Google, and it's going to throw up something that immediately becomes their scientific evidence. That could actually come from a blog that somebody has written, or it could be an opinion piece that somebody has, or it could come from a non-reviewed paper, or it could very well be published in one of these predatory journals. So you've got to be careful about where you are actually seeing this literature from before you actually start making opinions about the scientific field itself. All right. So now if I have to identify a scientific, if I have to identify a journal article that is to be presented, I'm sort of moving into the mainstream of the talk now. If I have to identify a journal article, then from this vast body of literature that is there, I actually need to sort of pick up one article that I have to publish, right? So from that 8,300 new articles that are published every year, I've got to pick one and then present that to the larger audience. So what's my basis for doing that? You need to be very clear about the purpose of the presentation, right? What are you doing this for? Are you presenting an overview of the field? Are you presenting to influence your clinical colleagues to change their clinical practice? Are you presenting it for a critical appraisal of the literature? So let's say you are presenting it to a group of PhD students who are doing research in a similar area. You picked up a new area and you want to sort of learn what is the new things in the literature. But like one example that Keyur was pointing out is probably an appropriate one. Or are you presenting to describe a new technique or some recent advances in the field? Depending upon what your goal is, the article that you're going to pick is going to change. Say if you're presenting an overview of the field, a meta-analysis or a systematic review will be a good one to present. Like what this picture says, this is filtered information, right? From all the articles that are published in the field, somebody has gone ahead and taken time to filter this information, capture the essence of all that is published there, and then they are presenting it to you as a meta-analysis or a systematic review. So for somebody new to this, to a particular field, who wants to get an overview of where the field is, a meta-analysis or systematic review is a good one to actually have. Bear in mind that these meta-analyses and systematic reviews will be large, will contain a large volume of information, and it may be difficult for you to sort of condense it into a single journal article, into say an hour long of presentation. If you want to influence the clinical practice, then certainly meta-analysis, systematic reviews, and randomized control trials are good papers to actually have. Say for instance, if I want to think about a new treatment option for accommodative esotropia or for hyperopia control, what do? I can go and look for meta-analyses that have looked at various different strategies for correcting hyperopia or for fixing accommodative esotropia, and distill that information to say, okay, this is what as a clinical practitioner you could be doing. And so therefore pick an article related to that. If you want to do a critical appraisal of the literature, the same 2-3 things will be applicable. But if you want to do a technique that you want to specifically learn or describe a recent advancement in the field, typically a cohort study will be a good one to pick. A cohort study is a very specific study, a single study conducted by a single center or at the max 2-3 centers put together. They are addressing a focused question with the focused methods and things like that to learn things. Notice that in all of this, I have not included case reports at all. In my mind, case reports is the starting of providing an evidence, but it doesn't, you've got to sort of build on that. So as a journal article to present it, I would not pick a case report, but it does, because it doesn't give me any coherent information about how the disease or a particular condition actually functions. It gives me one example of how it can present itself, or at the max, a few people who can present with similar kinds of symptoms. So I would avoid picking case reports. So at a personal level, when we do journal clubs in the lab or for our group, we typically pick points 4 and 5. Our idea is to describe a technique or learn a new technique or describe recent advances. So I usually encourage pickup students to pick RCTs, randomized control trials, or cohort level studies for presentation in the journal club. All right. So every journal article tells you a story, right? Which is why you are sitting here and listening to me, figuring out what story am I going to tell you. And in that context, I really like comparing a journal article to a movie that is published, that is out in the theaters, right? So a movie is also meant to convey the same story as a journal article is. And for the rest of my talk, I'm going to use these two material as the prototype of this. I'm going to pick Sholay as a movie. I'm assuming most of you know what this movie is, and most of you have probably watched this movie also. Remarkable movie. If you haven't seen it, highly recommended from my side to go and watch it. I'm also going to pick up this paper that we had published on RAPD assessments using a device that we built. Good paper, but I'm not going to say it is as great as Sholay and things like that. So if you are interested, feel free to go and read it. I'm very happy to talk to you about it. So first question to actually ask in that in picking a journal article is, okay, what is the title of that article, right? Obviously, Sholay is the title of the movie, and the title here is a longer effect of light intensity on RAPD in unilateral neuroophthalmic pathologies, right? The second question you want to ask is, okay, whose movie or article is it, right? These are introductory sorts of information that you want to present while you are picking the article. Whose movie is it or article? Essentially, in the movie, who is the director of that movie? Ramesh Sippy is the director of this movie. And in this article, there are several authors who are involved. Rahul Negi was the lead author, and I was the corresponding author of that paper. Right. And the third is who or what are the key players? What is this? Who are the ones who are going to tell me that story? Look at this. The key players are all of these guys: Dharmendra, Hema Malini, Amitabh Bachchan, Sanjeev Kumar, Amjad Khan. All of these people, very famous Bollywood actors, are the ones who are the ones who have acted in this movie. And the keywords for me is inter-examiner variability, meiosis, mydriasis, parasympathetic reflex, right? These keywords tell me something about what this paper is all going to be about. And these keywords are also important when you want to search for an article in a particular area. Let's say I use PubMed to search an article. I can use these keywords and my article will actually get picked up. If I were to search Amitabh Bachchan's movies from the 80s, Sholay will totally get picked up, right? That's what the keywords are really meant for. Who funded this work? Very, very important question, right? For any of this kind of work to happen, a sizable amount of funding is actually required. In the case of Sholay, it turned out to be Ramesh Sippy's father, G.P. Sippy, who is the producer of the movie, right? So there is the previous, photograph didn't show that. Therefore, I changed the picture to show G.P. Sippy is the producer of the movie. And in the case of this paper, the Center for Technology Innovation, Hyderabad Eye Research Foundation, Brian Holden Institute of Optometry and Vision Science, essentially all smaller entities within the LV Prasad Eye Institute, they are the ones who have funded our work. It's important, this part, because any funding agency that is supporting your work would like to see their names to be explicitly stated in this. For good reasons, because that's the very reason they are funding your work, so that the rest of the world knows that this entity is interested in funding this kind of research that's going on. So as a presenter, it's important for you to indicate this. It's also important to get some conflicts of interest information. So let's say I am an industry that is promoting a particular drug or promoting a particular kind of spectacles or promoting a new kind of a therapy. As an industry, I obviously have vested interest in the success of that particular technology. So if I have funded that work, it is very likely that I am going to be presenting positive information about that technology. So there is a conflict of interest in the sense that somebody who has vested interest in the product that I'm talking about has actually funded my work. So you want to keep that in mind as a presenter and interpret the results of that paper in the context of who is actually funding this. So it's an important component that tends to be sort of hidden in the journal article. All right. What is the content in a nutshell? For the poster in the movie is actually a phenomenal thing that tells you what this movie is all about, right? Right away, you can see that Sholay is not a movie about romance. It is not a movie about any kind of political drama. It is not a science fiction movie. It clearly is a movie involving, it's an action movie. It involves a lot of fighting. It looks like it also involves friendship, because here is Amitabh Bachchan and Dharmendra on top of each other and in a motorcycle. Lots of gunfight, lots of wrangling the other person's neck and so on and so forth. But it clearly tells you, that picture tells you that this is about an action movie. So I'm going to go and watch Sholay if I am an action fan. I'm not going to watch Sholay if I am a romance fan, for instance, right? Similarly, the abstract in the article tells you what the entire paper is about in a nutshell. The paper, if you recall, is actually from 614 to 624 pages, about a good 10 pages long. But the abstract is at the max about 300 words long. It's easier for me to read 300 words than read 10 pages worth of text. So the abstract gives me a clear indication of what is this paper about, what did they find, what did they conclude based on the science question that they have asked. So as a presenter, the most important thing you need to do is to read the abstract, see if this fits in with what your purpose is when you're picking that article, right? And when you and that is what most of your audience are also going to do, is to read the abstract and start making some judgments about the journal article itself before they come and listen to you in the journal paper. So that poster for the movie and the abstract for the paper are very, very critical entities. All right. Sometimes, in fact, many journals these days are actually asking for a textual abstract and also for a graphical abstract, right? The graphical abstract in this case is something about objective pupillometry. So we are right away conveying that, hey, this is about a new device that we are going to talk about, and it's a handheld portable kind of a device. So it tells you something about the kind of article that there is. All right. Are you picking a article that is classic or is it contemporary, right? Are you deciding to watch a movie that was published in the 1950s, or are you watching something that was published a couple of months ago, right? Not published, I keep using the word published, that was released in the 1950s versus something that is released only a month or two ago, right? So depending upon that, I can see some very interesting trends that are there. Look at the color itself and the way the posters are made, almost like line drawings. You know, Nargis is sort of represented as a line drawing, and here I think it's Kangana Ranawat, who is sort of very suave, very savvy kind of appearance in the more recent posters. Somewhere in between, you can see the evolution of it from Sholay to Pathan and all of these. Similarly, for a research article, you want to look at what sort of a stage period in which this article was published, right? I have picked 4 papers, including the one that we have been using to discuss, to indicate the different time frames in which it was published. One of the first papers on pupillary reflexes was published in Journal of Neurophysiology in 1959, right? And from then on, systematically, there has been research that is happening. 1959, another one that I picked was 1973, and then again in 2006, and our recent article in 2023. Notice one thing remarkable. Lawrence Stark, another Lawrence Stark, the same person has been publishing this work for close to about 50 years in that field. So the same individual has been contributing to this field over and over and over again. And that's really how science actually develops. You never do one research paper or one article that's going to now completely change the world we live in. I mean, there are examples of this. Einstein's paper on relativity did change the world. But for most of what is going on around us, it's only going to be incremental improvements in the scientific knowledge. And this, I particularly put this together to indicate the evolution of our knowledge on pupillary light reflexes over a period of time. There are thousands of articles like this that are published, but I just wanted to give you a sense of the timeline that it is published. This is also important for the audience to get a sense of what to expect from that paper. If I am reading something from the 1950s, right? I know that this was times before modern day computers existed. So in my modern day electronics existed, right? So in the research methods, in the techniques that they have used, I am going to not expect usage of computers, usage of signal processing, image processing, things like Photoshop and things and technology like that to be used. But when I'm reading something from the 2000s, I do expect that, okay, these guys would have used some form of modern day electronics to essentially drive the science possible. So from the date, from the year in which it was published, I already have a sense of what to sort of expect from that paper, what sort of methodology to sort of expect from that paper. The other thing which I feel it is wrong, but I still do it as a, because I am biased, is looking at who the authors are. Once I know that, hey, this paper has come from Larry Stark, I know that this is going to be a very seasoned paper. This is written by somebody who has tons and tons of experience in this field, and I am bound to learn something new from this paper. So I am already going in with the impression that this is going to be a fantastic paper. I'm going to learn a lot from this. But if I don't know the audience, if there's a new people who are publishing in that, then I'm going to approach it with a little bit more of what do you say? Little bit of more of doubt. I know that's not how it should be. I should approach the paper for what it is without getting biased by the authors. But as humans as we all are, we are all bound to be biased. And this is one of the bias that I experience or I fight every time I am reading one of these papers. So at any rate, the point is, what is the nature of the article? Is it classic or is it contemporary? That's what I want to. So these are all the background information. These are the basis on which you are going to be presenting this work. Now, as a presenter, what is your job? My job is the following. One is to understand, assimilate, and convey the story to the audience. Remember, you are the ones who have you are the one who has invested a lot of time in reading the paper. It is your responsibility to sort of convey that information to the larger audience, to know, to describe what the paper is about. So if you want to convey it, you better understand the paper and assimilate the facts in the paper to begin with, right? So that's your first job. The second job is to present the facts as is. Whatever was done in the paper, you're presenting this, and then your interpretations of it. Oftentimes, you find that people who are the person who is presenting that article is a very sort of attached to the article. They cannot accept somebody criticizing that article, right? And it's good to have ownership, but at the same time, you don't want to be completely sort of biased, saying I am presenting this and therefore I'm presenting the world's best article out there. You want to present what the article is doing for its own sake, and then you add your interpretations, positive or negative. Your job is also not to criticize the work. That's the other extreme of things, right? Every time I pick an article, you want to go on criticizing it, saying this is bad, this is bad, this is bad. And the audience are sitting there and wondering, okay, if it is that lousy of a paper, why did you even pick it? Why are you wasting 1.5 hours of my time criticizing the work? So your job is to essentially present a balanced perspective. These are the strengths in that paper. These are the limitations of that paper. This is how they did, and this is why it is strengths. This is what they could have done, and that's why it is a limitation. So that's the balanced perspective you want to actually present. So keep in mind that you are the spokesperson of this paper. The audience will judge the paper based on how you are presenting it, right? So your job again is to go and do this, a very balanced perspective of what the paper is actually presenting. So step one in all of this is for you to understand the background work. This is again a common mistake that people do, especially the early career researchers. You go and look at the article and you only read whatever is the information that is presented in the introduction section of that article. I am not going to make you guys read this, and I apologize for the the shift. These circles are meant to highlight the citations that are there. So your response to the citations in that paper are actually meant for background work that has been done in that area. And as a presenter, you need to be aware of the background literature. So while you have picked this particular article to present, the expectation is that you would have gone and read those background literature as well. In this case, I have highlighted 8 such papers. You have to be reading that background literature also, so that you can put this paper in the context of the larger work. Remember, pupil work, for instance, has been done right from 1959 to 2023. So obviously, the 2023 work is built on the previous science that was conducted. So your responsibility as a presenter is to give a sense of what that background work is also about, right? So the background literature sets the scene for what is known and what is not known. This is where I think the main characters in that paper are introduced, much like, in the movie, how characters are introduced through scenes. The introduction section is where these characters that will build the story are actually introduced. The second is to summarize the main question. At the end of the introduction period, you will typically have a few statements indicating what is the aim of the study and what is the hypothesis that the study is addressing. So you want to very clearly identify that. In order to do that, you will also have to identify what is the independent variable and what's the independent variable that is actually reported in this paper. In the particular paper on the pupil reflexes, the independent variable turns out to be light intensity, how much of light will produce how much of RAPD score. So the dependent variable is the RAPD score. The independent variable is the light intensity. And this paper is all about providing a relationship between the independent and the dependent variable. So you want to very clearly identify the main question that is there. So in this case, we have written here, the study tested the hypothesis that right? So that statement needs to be highlighted in your presentation, and you want to point to that in your journal club presentation, right? If a hypothesis is not present, right? So many papers need not explicitly state the hypothesis. They may only state an aim statement in the paper and move on. It's your responsibility as a presenter to say, okay, knowing what the independent and dependent variables are, what could be the hypothesis that they are addressing? This is where you put in your thought and say, if I were to be doing this experiment, this is the hypothesis I am going to be testing. And you want to sort of state that as well, saying that, okay, the aim was this in the paper. From this, we have derived the hypothesis to be ABC, and this is the hypothesis that the study is going to be testing. So that information is going to be important as well when it comes to the introduction, the study aims and stuff. Methods. One of the things that I encourage my students to do, and this may not be always possible, is to do a thought experiment, right? Based on the aim and the hypothesis, I already know what sort of question this study is actually going to address. If I were to do that study, if I were to conduct that experiment as a thought experiment, how would I do? What would I do to address this, right? So spend some time before reading the actual paper, spend some time introspecting, saying, if I were to do this, what would be the methodology I would follow? And then go ahead and read, okay, what have they done? If it matches, if your thought process matches with what they have done, fantastic. This is exactly what you would have done. That's what they have also done. Let's go and read. If the thought process doesn't match, then the question is, okay, where is the difference? Why have they done differently to what I thought about it? So that thought process of going back and forth about how would I have done it is an important step in the whole process of the methods. You don't have to present this to the audience, but it will be good to sort of, introspecting, saying, okay, this is how I'm going to understand that process. This is for your own learning as opposed to the presenting part of it. You understand the overall methodology first and then worry about the details. Like, remember, this is a story that you are presenting. In the overall methods, as the story evolves in Sholay, there are many critical scenes that are there, right? All the way from the, I don't think this is necessarily in sequence, but if I remember the movie right, it starts out with Gabbar Singh, cutting the hands off of this person, and then the whole sort of movie unfolds. These scenes are the critical features in that movie. If I were to represent the method section in that paper, I want to find out what are the critical pieces of information that are to be presented. Okay? Don't worry about the trees. Don't get lost in the trees for the sake of the forest. Your job is to try and get a 20,000 foot view of the problem and present that to the audience, as opposed to getting caught in the fine details. I'll give you some examples of this, right? So the airplane going over the forest, the message that is conveying is more important than that every single tree in that forest. What is that telling you? You're never going to complete your journal articles if you continue on in that stream. So here are some examples of it. I'm not going to obviously make you go through all of this. Important information would be is how did the authors recruit the patients? What was the protocol that they had followed? Okay, what was the device that they had used? What was the hardware in that device? What's the software in that device? Are all information that is written here and you want to present key information from that and present it to the audience. Every single line that you get, you need not be reading. You can simply summarize each of those sections into 2-3 statements and present that to the audience. Some of the things you do not want to get into. Here are the trees for the sake of the forest. As authors, we will give all the possible details. Say, for instance, this is the LEDs. It was managed by a microcontroller. What this microcontroller is, what software was used to manage. All of these are too much of details. Unless you are sitting there wanting to recreate that entire product once more, I don't care how the microcontroller worked or what microcontroller you used. The critical thing for me to know that it was electronically controlled. That's all. And then move it. Similarly, the design itself, right? Or it was solid, the computer-aided design, this software sliced into multiple stages, used a 3D printer to print it. All of that are unnecessary details for the purposes of the presentation, right? You can simply say that, okay, this was a device where light levels was controlled using electronically using a microcontroller. The device was essentially a 3D printed device. It used an algorithm that was previously published that detected the pupil edges and then move on, right? If the audience have some question about this, you can always come back and discuss the details. But do not overwhelm the audience with all that detail so that you are also lost in that process. The audience is also lost in that process. Give the big picture to begin with. Now you have done the introduction, you have set the scene for this, you have also told them how this was done. Now it's time to look at the results, right? Step 1, again, introspection. Are the results making intuitive sense to me? If I were to do this experiment, is this how I will expect the results, right? That introspection you want to go through first. Again, you need not convey this to the audience, but you will do this during your background reading to see if I were to fully understand this article, are these results making intuitive sense? If it is making intuitive sense, great. I am going to essentially go forward with the results. Every article typically is going to contain some figures and some tables, right? On an average, articles will contain about 3 to 4 figures and about a couple of tables, right? Turns out our article that I'm using did not contain any tables at all. So I picked up an paper from Mathur and Atchison in 2011, just for representative purposes. Subject details is presented here. And because this involved whatever astigmatism and stuff they were studying, they have indicated the details of every subject. So you may want to go through that and say, okay, look at this. There were 10 different subjects, 10 different refractive errors or 10 different disease conditions that they had, and quickly highlight critical pieces in that table. Second is, when it comes to figures, many figures in papers can be complicated, and I will concede many of the figures that I end up creating for my own papers are quite complicated. You try and condense a lot of information into a single figure, and therefore it will take time to interpret those figures. It will take time to orient yourself to those figures. So what you want to do for your audience is start out very clearly labeling what is on the y-axis and what is on the x-axis. In this particular figure, pupil diameter is on the y-axis, time is along the x-axis. And you then indicate, okay, what are the different colors in there? There is a red trace, there is a blue trace. What does that mean? In this figure, there are multiple symbols that are there. What do each of these symbols mean? Orient people to the figures, orient them. If there are error bars, tell them specifically are the standard deviations or standard errors of means. Very specifically indicate each of them, and then get on to describing what the result is showing. Super common mistake that you see. You throw a figure that is complicated and you say, hey, this is what it indicates, and then you move on. By the time the audience are even sort of orienting themselves to it, you have moved on from that figure, right? Now, for instance, in this particular figure, it says, oh yeah, this is controls. This is where, look at this. This is normal pupil responses. This is right eye RAPD. This is left eye RAPD. I will move on. What in that figure told me this is right eye RAPD? What in this bottom figure told me it is left eye? So Spend some time orienting the audience to the figures. That's what will get you to, that's what will get you to clearly identify what the outcomes are. Many figures can be very, very similar looking. This is something that I wanted to point out. So spend time in each of these. I said spot the difference because almost every trace in this looks very similar. There are subtle differences in each of these that you may want to spend some time and orient your audience to this. Similar examples in other papers, right? Very, very similar looking figures will be presented. If your paper has multiple experiments, right, which again happens in many of the cases that was there in many of my own experiments, multiple experiments are there, and in each of them, there will be multiple results that are there. Do not combine all the methods into one and all the results into one. The audience are going to be lost with that. So you want to pick specifically, these are the methods, this is the experiment, these are the methods, and this is what we wanted, this is what the results are showing. So there are 4 experiments in this, 4 different methods, 4 different results. Go through each of them sequentially. So the story gets built as we move along in that paper. Finally, you have done all of that. You have come to the final part of the paper, which is the discussion and the conclusions. The golden rule is that a good story has to have a good ending, right? The Sholay is fantastic because it had a very nice ending towards it. So what is the ending in your story? What is the ending in your paper? Discuss all the points that were raised in the introduction. You must have raised, these are the gaps in the literature. This is what is the aim. You want to try and conclude saying for that aim, this is what the audience have found. Compare the results to previous literature. You remember, science is incrementally built on previous literature. So how is your results comparing with the with the older ones? And compared to the older ones, what have I added to this? And very importantly, also talk about the strengths and the limitations of the study. If you end up dividing your discussion section into these 3 components, you're more or less covered the entire discussion section. Lastly, perform your own interpretation of it. Your job is not only as a translator, right? Your job is that of an interpreter. So you not only translate the science knowledge from one article to another, but you also interpret it and say, okay, what does it imply to be? And finally, 1 or 2 crisp statements about the conclusions and what are you concluding out of it? What are the authors concluding out of it? Right? That's where it ends. A couple of slides and then we will conclude. Common mistakes while making a journal presentation. One is students, this is especially first-time presenters, they want to pick a super easy article, right? Because it's easy for them to do this. There's nothing wrong in this, except that easy articles need not always have a strong methodology or a message. It will end up wasting time for the audience. Your audience are going to be cross at you saying, why did you waste my time? Other extreme is, I am going to pick super complex article, too many figures, too many tables. By the time you finish the 3rd figure in the 10 figures that are there, time is already up. You cannot complete it. Third mistake is, I have picked up an article from a dubious journal. Remember one of those gray literatures or some of those, these predatory publications. By picking articles that are published there, you are indirectly endorsing such publications, and you do not want to do that. You want to pick journal articles from papers that have a good, track record of publishing. Finally, you have picked up an article that is so esoteric that nobody cares about this. Again, the audience are sitting there and thinking, okay, what a waste of time. What did I really learn from this whole process? Easy to fix all of this. The biggest fix is choose the right mentor. The mentor who has already done this multiple times will have a good handle on what to present, what to not present, and work with that mentor to pick the correct article. Pick up an article that has good number of citations. Here are some examples that I've given from Google Scholar. Some articles like Campbell and Robson, 1968, 4,500 times they are cited. Clearly, this article has had a big impact on the on the result that is that the thing has published. Another one is, another one, I mean, put contra-sensitivity as the keyword, and therefore all that articles came up. So pick up articles that have really good number of citations. Newer articles typically will not, right? Because these citations take time to accrue. So very, very new articles, may not have good citations, but if your mentor feels that this is a good research methodology and stuff, go for it and pick it. Okay. In that context, I did want to point out, if you search in Google, you will get the top 100 articles in vision science. This is a highly recommended list that for all the optometrists and vision scientists out there. These are must-know articles in vision science. So if you ever conduct a journal club as a group, try and pick articles from one of these. These are listed in the order of the citations that they have accrued. So in summary, journal articles are the most prominent medium through which new knowledge gets communicated. For as optometrists, it's mandatory that we read these because we have to stay abreast with the recent developments. When you're picking an article, bear in mind the volume of the scientific literature that is there, the purpose for which you are doing this journal club. Accordingly, pick the right kind of article to be presented. Stay away from gray literature and predatory publications. Those are a big no-no in my end for publishing. The journal article is meant to convey a story, much like a movie. You want to focus on the key points in that article, read the background literature, and don't lose the forest for the trees. Again, an important piece of information. And for those of you who are new to this game, work with a mentor. They will know this, and they can help you pick the right kind of article. And finally, ensure that you are going to be spending a lot of time in reading this article. Your audience are going to spend time listening to you, so make it a worthwhile experience for all of them. With that, I wish you all a very happy World Optometry Day once more. Thank you for your time on Sunday afternoon, and I'm happy to take any questions if they are. Thank you very much.
Thank you, Dr. Bhardwaj. That was an excellent talk. I wish I had that about 7-8 years ago. That was summarizing a lot of information that I've learned over the years into a very succinct presentation. Really appreciate that. So if there are any questions from the audience, please post your questions in the chat, and we can take those questions right now. In the meantime, I wanted to ask you this because I know a lot of people have asked me about this. How do you identify predatory journals? Because it's so hard. They do such a good job of making it sound like they are authentic. How would someone who's novice, avoid getting published in there, or pick an article?
No, you're absolutely right, Keyur. These predatory publications are becoming smarter and smarter, right? It's harder to pick up these. So there are 2-3 key features. One is there is something called as the OOLS list. I will type that down. This is a librarian list of predatory. Sorry, I'll type it down. So OOLS list, Jeffrey OOL was a librarian in one of the US universities, and he was the first one to flag these predatory publications. And he listed out a bunch of papers that are the good quality journals. And if they don't feature in that, they are likely to be predatory. He got into a lot of trouble for this because obviously, all these predatory journals were not happy with him. But his database has gotten updated over a period of time. So that is one. The second thing is, if I can actually go back to one of my early slides. Actually, let me do this. I'm not sure that I have indicated this here, but let me maybe I'll use this one, KO. So notice how I've said it takes 4 to 6 months long for this process to actually complete. A good quality journal with good quality peer review will take about this long for it to come through. One of the classic features of predatory journals is you submit the article today, in 2 weeks it is accepted. There's no way in hell that you can go through this entire process and have the whole thing done in 2 weeks. So look for when the article was submitted and when it was accepted. I don't think I have that information here. I had removed, I mean, I cut it off from this, but it will clearly tell you what was the submission date and what was the acceptance date. If there is a good 3 to 4 months or 4 to 6 months time in there, that tells you it is a good journal. The third identification mark for predatory journals is they will usually try and masquerade a regular journal's name. Say, for instance, I have Optometry and Vision Science as a regular journal. A predatory journal could be International Journal of Optometry and Vision Science or a World Journal of Optometry and Vision Science. So any audience looking at it is going to ignore that bit of World International. They will only focus on Optometry and Vision Science. So these are some of the subtler things, KU, to look for when you want to try and identify those predatory journals.
Thank you so much. We have a question in the chat by Manish Bhagat. He's asking, can you please explain about impact factor and its importance and how it's calculated?
Yeah. So Manish, the impact factor is, for those of you who may not know this, is a number that is given to a journal in terms of how impactful that journal is in the list of all the journals of related areas, right? So that tells you, the word impact factor tells you that the journal, an article published in that journal can create a certain amount of impact in the society. Larger the impact factor, higher is the impact that it is likely to generate. In general, journals that are focused on broad science space will have a higher impact factor because they do publish articles of all possible sciences that is there. Nature, Science, or New England Journal of Medicine. These are high quality journals with impact factors in the range of 40, 45 and stuff. Most optometry, vision science, ophthalmology journals have an impact factor ranging anywhere from 1 to about 5 or 6 at the maximum. Now, that's because the field that they are publishing in is a narrower field. Only a limited number of audience will be reading papers in that compared to these broad-based journals. So in general, while higher impact factor is indicative of a more prestigious journal, lower impact factor does not mean it is a bad journal, right? So and the impact factor is calculated using a fairly complex formula, Manisha. The total number of articles that are published in that journal to the number of times an article is actually cited from that journal. So it's some broad formula like that. I also don't know the exact formula. So higher the impact factor means that more articles in that journal was actually published in that, more number of articles that were published were actually cited from that journal. In general, I will not get biased too much by the impact factor. Impact factor tends to change year on year for these journals. Journals that had fantastic impact factors do not have that good of an impact factor today. Doesn't mean that those that were published earlier on were poor quality papers, right? One example is the Journal of Physiology that I was pointing out. Let's again go back to this particular example that I was giving. You see this this particular article, Campbell and Robson's applications of this is the Journal of Physiology in 1968. Now, today, Journal of Physiology is not something that you would consider publishing in at all. It doesn't feature in the list of prominent vision science articles and stuff, and yet some of the most prominent research has been published in that journal. So I wouldn't worry too much about the impact factor, Manish. I would rather focus on the quality of the science that your article is presenting.
Thank you. Thank you. That was very informative. We have one question from Priyadarshini, who's thanking you for the wonderful talk and is asking if, let me summarize that. If they're doing a journal club on myopia, say, is there a specific journal or database while choosing an article? So basically going back to how would you choose an article for a journal club?
Right. So the choosing an article, Priyadarshini, in very broad sense is what is what the slide is actually telling you. I don't think so. Usually, for a particular type of an area of work, let's say you are pointing out myopia. Typically, those kinds of articles will get published in about 3-4 major journals, right? So, investigative ophthalmology and vision science, optometry and vision science, ophthalmic physiological optics. So 3-4 journals like this is what will publish majority of the work. If you're interested, let's say in electrophysiology, Documenta Ophthalmologica and journals like that. So every journal has sort of their focus area that will let them publish papers in those. You want to sort of try and look for papers in that area. These days, however, what happens is you will actually identify an article based on a PubMed search or based on a Google Scholar search. So you want to put in the right kind of keywords. Say just saying myopia will give you 20,000 articles. Now within that, you want to sort of say, okay, myopia epidemiology or myopia correction strategies or myopia and peripheral refraction. So keywords like that, if you add together, you will narrow down your search. And once you have, let's say, 10 articles or so that sound interesting to you, go back to your mentor and they may be able to pick up 1 or 2 from this that you can utilize for your. So I hope that has answered your question, Priyadarshini. I'm not giving you a very, very specific answer for this.
Okay. Well,
there is no template, or at least I do not have any template for presenting a JC. I would like to keep that as more of free-flowing information. Broad template is what I have been talking about. In general, I don't like templates very much because it tends to constrain somebody's, freedom of expression. So feel free to go and do what you think is most attractive.
I think in the interest of time, we will close this session here. And if there are any questions, please feel free to email specifically, and we can get to as many as we can. Thank you once again, Dr. Bhardwaj. This was excellent start to this journal club, and I will pass over the screen to Bhavya so that she can continue.
Yeah. Thank you, Mr. Kayur. Thank you, Dr. Srikanth, sir. It was wonderful having you on a Sunday afternoon with us. Thank you so much. And for the participants, if you all have any more questions, please write us to info@ocindia.org. I will put that in the chat box as well. So since this was the first session, we thought of having it for no cost for everybody who would like to join this journal club, and henceforth we will be having a membership fees for the journal club session. Need not say why you should join a journal club, as already Mr. FB and Mr. Kayur has already explained you about the importance of having a journal club. So we are having a membership fee for an individual student or a practitioner for about it is $299, and also for if your college is getting the membership, then all the students can have the access for the journal club. So the college membership fee would be 599 rupees, and we will be having 2 sessions every quarter along with the OOLS team. We also have the Google Forms that has been there put in the chat box. So if you all are interested to get the membership, please fill in the Google form and then you can make the payment further. Thank you everyone once again for joining us on today's session. So we will be announcing our next date of the journal club very soon on our social media. Thank you all.
Thank you,
Thank
guys.
you.
Have a good weekend.
Thank you. Thank you, sir.
Thank you.